Hey guys, welcome to the Rainbow and Bloom channel. I'm Melissa. The Rainbow and Bloom channel is a channel about living and thriving with the autoimmune disease known as scleroderma. I am a survivor of scleroderma and late-stage Hodgkin's lymphoma, and I wrote a book about my journey called How Death Saved My Life, which is available on Amazon. Remember to subscribe and click like if you like this video. So today, this video is an intro to a video I created back in April. And it was about, and it will be about, the things we accumulate while living with chronic illness for years and years. And I have accumulated basically a pharmacy of stuff. And I was going through all of the things that I had. Like, I have a lot of stuff. Even the stuff that I showed is only about half. But I was in the middle of it, and the reason why you only saw like half, actually I discovered more in the basement after I did the video, but my camera cut off. So I had to do another little piece at the end just to say goodbye and all this stuff. So I wanted to do this little intro into the video, and it's gonna start soon. And basically I just cover, I show you what I have basically. I mean, I need to still get rid of this stuff, and if you happen to have medications that are still good, or just medications that you aren't using anymore, you do not flush them down the toilet. You take them to your the police precinct. They usually have a kiosk where you can bring the stuff, or you do not throw them in the trash. You can also wait until twice a year, the federal government has a national day for disposing of excess pharmaceuticals, and they take care of it and dispose it responsibly, because if you flush it, throw it in the garbage, it ends up in the ground, it ends up in our water supply, and we all end up getting overly medicated just from drinking water. So you want to make sure to not dispose of your medications yourself. Okay, so here comes the video. Let me know what you think. What do you do with the extra paraphernalia you end up with from just living with this stuff, this illness for however long you have been? All right. See you on the other side. Hi guys! Welcome to another edition of the Rainbow and Bloom channel. I'm Melissa, and today I want to talk to you about drugs. Yes, drugs. And the drugs you accumulate over the years of having to deal with autoimmune disease. I have a crate of drugs that I don't even think I can pick it up. And it's not just drugs, it's also what I like to call paraphernalia. Sickness, chronic illness, paraphernalia that accumulates over time, So I had to deal with this for, over a decade. And along the way, you're prescribed things, and there's a lot of reasons why you end up with like a huge stash of drugs. And so I wanted to talk to you about drugs, not only the drugs, but how to get rid of them when you don't need them anymore. So I have this thing, which is like a million pounds from years and years. And this is actually not as much as it used to be. I got rid of a lot. But it's like all kinds of things. Let me put it back down. Oh, Lord. It was worse. But like, I have a lot of it is expired, obviously, but over the years you try different drugs. There's reasons why you end up with more drugs than you should have. You end up with a mini pharmacy in your house. Is, you know, you try a drug, it doesn't work out for you, so you have the remainder there. You know, a better drug comes out. That's another reason. You might have all the old drugs you had, and then you have the better drug and you start taking that. You have an allergic reaction. You lose track of it and you get another prescription filled and then you have too much, or even the pharmacy, like they can kind of lose track and end up giving you more, and so you have overlap. You just end up with all these drugs, right? So, and a lot of it, when you have chronic pain, a lot of it is like that strong stuff, the stuff that shall remain nameless that everybody's talking about now. All right, let's just say opioids. But so I wanted to talk to you about the drugs. Oh, there's so many. Sumatriptan, that's like for migraine, so that's not really autoimmune related. But a lot of that, and I have Adcirca for my hey. Oh yeah, this is empty. Empty bottles also. Gotta get. This is Up Summit. I still have some in here, so I'm gonna still use this. But so a lot of different things, like for coughing and antibiotics. I had to take a lot of antibiotics before. Stuff for coughing, things for you know, inflammation, like prednisone. I don't think I have any prednisone left, but stuff for the skin, you know, to handle, and it's dusty. Woo! To handle like the plaques that come out on your skin and the dryness. Oh my gosh, the dryness. Your skin can be like a desert and nothing can get in there. No kind of moisture can get in there. So sometimes you need a prescription to handle the dryness. But I have a lot of this hydrocortisone, like a lot of hydrocortisone. Like, why do I have so much hydrocortisone? This is another ointment. So I have a lot of this stuff. Oh my gosh, why do I have so much of this stuff? This, like, there's more. So you end up with a lot of drugs that you don't need anymore. And there's a way to get rid of it, right? These are supplements and inhalers. These are mostly supplements that it was a complete waste of money. Just like all this stuff. This is a dusty bin. And then I have like medical supplies. So I have these, you know, like this was for waste. One thing I'll cover in the book is I had a wound vac in my back and I had to get rid of a lot of waste. So, and this is what now? Like this is like to flush the IV, and then syringes and wraps and all kinds. One of the things you can do if you have all this stuff that you're not using anymore and it's still good is you can actually take it back to your doctor and just like give it to the doctor to help patients who might not have insurance, and you're not supposed to, but they'll also take drugs that are still good. So if someone doesn't have insurance yet and they just need an emergency stash, it's the same prescription that they would give anyway, and you got it from them anyway. So sometimes they will help a person out. Not my doctors, I'm just saying. I heard it somewhere that there's doctors that do that. And they will give it to a patient that is in need. If you want to do that, that's another way to get rid of excess medications you don't need anymore, thank God. But also, you know, these things, equipment, I have all kinds of tubing, gauze sponges. I have to give these to somebody. Catheter stabilization device. That's a story. And I have lots of heparin. A lot of heparin. There's more. And then bags of like tubing for the something. Oh, I think this is related to the wound vac I had. So this is a lot of this tubing to give to somebody or the doctor. And then these things are like for your labs. And then a little bag to put them in, because I used to have visiting nurses and they would have to come get the labs and they'd take it back in these bags. I think that's what that was for. And this thing I've never used, Optichamber Advantage, valved holding chamber for use with metered dose inhaler. So this is supposed to help your inhaler be more effective. I didn't see a difference. It's supposed to help the medicine from your inhaler go more directly into your system or something, but I don't think that's true. And this is for your lungs. I don't know what they call it. It's Air Life is the brand, but it's like to exercise your lungs, and you're supposed to blow in somewhere. I think it's missing a piece. Like a tube, but you're supposed to blow and see, is that right? I think that's what this is. Yeah, see how high you can get this thing. Keep indicator between arrows. Yeah, so you're supposed to keep this joint. I'm from Philly. It's a joint. You keep it between here, and that's like to strengthen your lungs when you have pulmonary hypertension. And so this is just more gauze. I got gauze. I got more of this stuff. Tubing that I've never used. Another one of these joints. That's for the inhaler. You put the inhaler in there, and then you put this in your mouth, and they pump it, and then you're supposed to inhale from this thing. I couldn't tell the difference. And this is Philips Respironics. I think it's the same deal with the inhaler. Why do I have so much of this stuff? So that's that. Let me see what else I can. And then this is iodine. So my port made me allergic to alcohol, like the wipes and stuff. Like I would just get this horrific rash everywhere. So I had to start using iodine to clean my skin and everything else. So that's this. I wonder if it's still good. I don't see an expiration date. It's probably still good. And just more. Home infusion therapy. Yeah, so that was for my port. Not my port, right? No, the wound vac. More of that. More tubing for your breathing. This is some kind of syringe thing. Neupogen. Oh, it's for cancer. Oh my gosh. Never used. Expired 12/14. So it's expired Neupogen, and that's to support your white blood cells when you go through chemo and everything. And that's more of the iodine. And this is, what is this? Wound dressing. Yeah, girl, wounds. I had wounds. And this is one of these little tubing things. See, little, can you tell? Little tubing things for your, the ends of the the ends of the IV, like they put that there. So, and then more iodine. Wait, no, plain packing strip, whatever that is. I don't know. Oh, wound care. So if you have a big old hole, like let's say in your back, and they have to pack it so the fluid doesn't accumulate. Pretty, right? Fun. So they stick this stuff in your wound so it can heal fast and get rid of the moisture. Yay! So, and this is more Neupogen. Oh, somebody could have used that. I was too sick to be worried about all this before. So this is like, This is for the port. They there's like a little needle there and a little tube that they stick into you. So, and there's more. I have so much of this stuff. I can't believe it. I need to get rid of it. More tubing. And more of these tubes for blood work. See? Vacutainer. Yeah, this is a butterfly needle. Butterfly needle. I don't know why I have that though. Maybe for the visiting nurse. And some sort of syringe. Just a regular syringe. See, syringe. Oh Lord. This is what illness looks like. This is like, yeah, I think this is some kind of like for injections. I have a lot of those. And then another one of these and more, and a lot of this. I don't know, what is that? Something, I don't know, what to clean, I don't know. A lot of that. And then more of this stuff, the tray with the stuff in it. And this is some, oh, it's more the same. Wow. And these are like trash bags for your, wait, yeah, bags, just bags of bags of bags of bags. There's that, and there's more iodine, This is not the kind of unboxing you. So yeah, that's basically it. I have more. I'm still gonna do a video, which I said I would do last time, on what to do when you first get diagnosed. That's coming up this in the next couple of days. I will do it in the next couple of days and upload it for you. And until then, peace, tranquility, take care of yourself, try not to stress out, be hopeful, be grateful, and I'll see you next time.